but I think the last couple of years we have seen society have more and more problems, and people are not supported.
Between the pandemic and everything else going on in our world, our social workers are more important than ever, which makes March, Social Work Awareness Month, a perfect time to show off what they do.
People are isolated a lot, not only by the pandemic, but just by social situations in general. And that has required the social workers to take on more and more.
Director Kathy Fowler heads up the care coordination team at East Tennessee Children's Hospital, which includes our social workers. Social workers provide support to families who are fighting a tough situation. At Children's Hospital, they're concerned with making sure kids are in an environment where they can thrive.
From the support side, they are, attending to financial needs, attending to medication needs, insurance needs, all those ancillary things and the things that people need to be here in the hospital. Food, clothing, sometimes, people have other children.
And because Children's Hospital is dedicated to the health of the whole family, even after they leave the hospital, our social work team is available.
They need therapies, they need doctor's appointments, they need medication, they need follow-up visits. There are lots of barriers that people don't think about that can happen.
Sometimes the barriers families face take a lot of effort to break through, but our entire team has the experience and expertise to back them up.
All of the social workers are master's level prepared. They all take a test within a year after they have their master's as well to be able to work here. And they all do continuing, they have to have 15 hours of continuing education every year.
That education includes dealing with ACEs, which are adverse childhood experiences. Those may include violence at home, neglect, abuse, or having a parent with mental illness or substance dependence.
Whether a child has cancer and is, in the process of that treatment and the grief that goes along with that, whether it's the grief of someone passing, whether it's just the heaviness of, somebody's involved with DCS, or somebody is struggling with domestic violence, or somebody is struggling with drug abuse in their own lives. All of those things weigh very heavily on our parents, and then, like you said, our staff take that on.
That's why Children's Hospital is the best place for kids. No matter what they need, our team carries the weight when life gets heavy.